Exhausted, overwhelmed, angry. The COVID pandemic took a lot from Michelle DeMartino. When her heart started pounding, she thought it was anxiety. It wasn't. We explained the potentially deadly cardio complications that, in her case, trace right back to COVID-19. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. The COVID pandemic impacted all of us in one way or another, but it took an enormous toll on Michelle DeMartino. She lost both of her parents in less than a week. And as Janine Kiesling shows us, Michelle would face a health problem of her own.
Michelle DeMartino ran 10Ks and was always active. She contributed her increasing heart rate and lack of energy to stress. But as it turns out, she had a potentially deadly heart problem.
It's not even like work. It's honestly just fun.
All right, let's get to our community questions.
You might recognize Michelle DeMartino from our morning medical update.
We're going to talk about a new therapy that could not come at a better time than right now.
Not as a guest, rather an integral part of our team.
Hayes is holding steady as well.
For 15 years, she's been a professional sign language interpreter.
This is where the magic happens.
She was introduced to signing very young because of a personal connection. Her cousin happens to be deaf, and in elementary school, Michelle was placed in a special education room after being diagnosed with dyslexia. It was there she met some of her lifelong friends who, like her cousin, are also deaf.
I just kind of picked it up and kept going.
It blossomed into a career. In addition to working for the University of Kansas Health System, Michelle interprets for the mayor's office and translated the NFL draft.
It's something that I've always loved and gravitated to.
While her career continues to flourish, Michelle, like so many others, was hit hard by COVID in a multitude of ways.
I was mad at COVID. I feel like it ruined my life in a sense. This is my mom and dad on their wedding day.
On February 4th, 2021, Michelle's mom died from COVID. 5 days later, it took her dad.
This year's been really hard. It's my dad's birthday today, and he was my best friend in the entire world.
Reeling from the heartbreak of losing her parents, Michelle became depressed. Over the next year, she gained weight, felt increasingly anxious, and at times noticed her heart racing. Michelle believed her parents' death was the cause until she was diagnosed with COVID for the second time.
I started to really notice that my heart was racing even more, and I was getting nauseous and lightheaded. I was sitting right here and kind of fell on the floor and was just trying to breathe.
Michelle was referred to the University of Kansas Health System. There, heart doctors were able to quickly diagnose Michelle and provided treatment she credits for giving back her life.
And that's what I love so much about KU is you're not just a number, you're not just a everyday patient. They really do take care of you, and it's as a collective team. Without them, I don't know how I would have gotten to this point today. Honestly, I'm most grateful for KU.
And we are so glad that Michelle is able to join us here in studio, not on screen today. How are you?
I am doing good. That package was absolutely exactly how I feel. I wouldn't be here without KU today.
Well, and you have been with our show and program signing for us since this program began. It started, of course, because of COVID. We needed to communicate with the community, and you were there to communicate with the deaf members of our community. So we've been there with you this whole time, and we were with you when your parents fell ill and you lost them. I just have to ask you, and we have Dr. Ramirez with us too. I just wanted to ask you how you're doing with that.
I am doing good. I had a little bit of a breakdown yesterday. Mother's Day and Father's Day are coming up soon, and those are the two hardest days of the year. And I went and visited my parents yesterday and just kind of talked with them. But seeing that package honestly really impacted my heart. because I wouldn't have gotten through this without KU and the deaf community. It was my escape coming here. And interpreting for the amazing deaf community that we have here in the greater Kansas City area. And so,
well, you didn't get a hideaway when COVID came. You had to be here. Right. You had to be out in the community. Dr. Rigoberto Ramirez, he's a cardiologist and electrophysiologist here, and you're just going to help us understand exactly what's going on with Michelle's heart. And I know that he's part of the team that's been right along with you, so you two have quite a bond. But you mentioned in that story, Michelle, just how mad you are at COVID. You lose your parents. That's enough to anger anyone. And then you get COVID. What was that like?
The first time I got COVID, I think I was more angry then because I wasn't really sick. I just lost my smell and my taste, and I was tired for a day. But then the second time I got COVID, I was even more angry because I was one who was masking, social distancing, making sure I was doing everything right, and COVID knows no boundaries. It is going to find you, and luckily I was vaccinated, and which I am very pro-vaccine. My dad got the vaccine at the beginning, and he had lung cancer, spinal cancer, diverticulitis, and my dad never developed COVID pneumonia. My mom was 2 weeks away from getting it, and she developed COVID pneumonia. So my dad was a living testimony. He died from COVID fog and Alzheimer's. So that's just kind of a testament to that. But I was angry because, well, I was very sick the second time, very, very sick. And I was angry because I felt like it hit my life again, and then I started to realize things weren't really normal with how I was feeling, and that's when I was like, is this still depression? Is this something more? And I was also angry because it kind of split our world when we should always trust our medical professions. I trust KU with my life, with my children's life, with my family's life, and I was angry kind of at the world at how it was used for something else, and we trust our doctors. They go to school for this. This is what they do, and I couldn't be more appreciative of them, and that was kind of the reasons why I was angry.
Makes sense, for sure. When did you decide you needed to go get checked out, more than just getting that COVID test and just waiting out until you got feeling better? When did you start getting involved and it eventually led you to Dr. Ramirez?
I just started, actually my Apple Watch started telling me that I had an excessive heart rate. I would just be sitting there, and my heart rate on my watch you have an accelerated heart rate. It's an accelerated heart rate. And so I was like, maybe this is more than just anxiety and depression. And one day I almost collapsed. I almost got sick. It was really scary. And I had gained a lot of weight, went to Branson, could barely get up out of the go-kart, and that was the day I was like, I don't want to lose my life. I want to be here for my kids. I want to be here for the deaf community, for KU, and that's when I finally made the call.
Good call. Dr. Ramirez, so she was ultimately diagnosed with what's called long QT syndrome. What is that? I had never heard of that. Tell us what it is, what it means.
Absolutely. So long QT syndrome is, and we'll show you an EKG of this, which kind of describes it, but essentially if you look at an EKG, you see several bumps and spikes on the EKG. Okay, the first, the big spike is actually the contraction of the heart muscle in the bottom chamber of the heart. Thicker muscle, larger spike because there's more electrical current. But the second spike that has a T wave noted on it is called it's essentially the T wave, which what that is essentially the repolarization. So when the heart muscle cells fire, it takes time for them to recharge, and that time period is relayed in the QT interval, okay? The beginning of that spike to the end of the T wave is when the cell has, gone through the full cycle. At the end of the T wave, it's ready to accept that next impulse and essentially fire, okay? So this EKG will point us to consider diagnosis of long QT. Long QT is complex. there's two different types of long QT. One of them is the hereditary form, and that, the prevalence is about 1 in 2,500 for this, and many patients don't develop any clinical symptoms related to long QT, so they'll never know that they have long QT. It's just incidentally it's found, or they end up having a episode, that brings them into medical attention, and this is then looked into. In regards to the acquired long QT, that is more related to circumstances. So patients who are critically ill, patients who are on many medications, and also those who may have electrolyte abnormalities may be at risk of developing the acquired form of long QT. Long QT, the duration of that QT interval in women is usually greater than 460 milliseconds, and in men it's greater than 450 milliseconds.
So what you were describing, though, sounds like Michelle. Is that correct?
So Michelle, when she came to me, she had been told she had long QT syndrome, and what happens is that this happens a lot. Now, what I have to do is then determine does she truly have long QT syndrome, or does she have the acquired form, the hereditary form, or is she on the lower risk? Can we continue to monitor and give her some reassurance and say, you probably have the acquired form, which is what I think she had. She was on medications that could have potentially increased that QT interval. And that first EKG did look a little long, but it didn't look high risk long. It didn't look greater than 460 milliseconds. But with some adjustments in medications, she was much lower. And so that put her on the lower risk scale, and I was able to tell her with some reassurance, you can live your life. You can start doing the things that you want to do so that you're healthy. Start exercising and start working on those things again. Don't worry about this. This is something we can continue to monitor.
So you can fix it. Fixable.
What the acquired form of long QT is one that you can avoid certain circumstances. You can avoid, you can adjust medications. The medications, there's several medications that can cause you to have a prolonged QT interval. These medications are common medications that we use, for example, nausea medications, right? Zofran, those types of things, anti-anxiety medications, also, like
Michelle's
trazodone.
Shaking her head on everything you're saying.
And then there's also,
yes.
and there's also, basically antibiotics as well, so all of those, and what happens is when we're ill, we're trying to identify, what's the cause, but if you're ill, a lot of times you have nausea, they give you an antiemetic or an anti-nausea medication, then they give you an antibiotic, and then you can't sleep that night, they give you a medication, and that combination there is what can cause that QT to prolong, and I can talk a little bit later about what the ramifications of that long QT are, okay?
All right, let's do it now.
Let's do it. So
And does Michelle have it? Does she have prolonged?
So no, her QT interval has come down, and I think we made some medication adjustments. I think with the trazodone, I'm also limited. Yep, exactly. And we also limited, kind of the Zofran, making sure that she was careful with that. And by doing that, her QT came back, and it was within a normal range. Hers was 443 milliseconds, which is perfectly fine. Okay. Now, what happens with long QT, the reason it's so important is because when your QT interval gets longer, greater than 500 milliseconds, you're at risk for developing dangerous heart rhythms. These can form into a dangerous rhythm called torsades de pointes, and that's one that can become hemodynamically unstable. And so by identifying it and identifying those who are at high risk for it, you can start to eliminate, those other risk factors that may push them to get a QT interval of 500 or more, okay? Now, in regards to the way that the mechanism and the way that it works, so there's the hereditary forms of long QT syndrome are more rare. Those are the ones that are difficult. There's a lot of overlap. Sometimes patients have QTs of 453, kind of borderline, but they could have, they could still have long QT in the right setting. So the high risk features that I look for are patients who have had, for example, 3 types of long QT: long QT1, long QT2, long QT3. Long QT1 is associated with patients who have fainting spells with exertion or stress. It's the common one, very classic in patients who are swimming. So they may come in and say, every time I swim, I pass out. And I'm like, that's not common. You know, you need to think about, you know, whether they have that long QT1 form, okay? Long QT2 is associated in patients who are emotional, you know, with emotional stressors, a startle, an alarm that goes off, you know, someone postpartum, you know, females are at higher risk of developing syncope while breastfeeding, those types of things that should not happen, right? And the third one is long QT3 is essentially one that happens, fainting spells when you're at rest. So those, if I hear of if I listen to the story and if I see those and I look at the QTC and if it's above the range, those are the patients you're going to bring in. We need further testing. You know, I need genetic testing, I need a stress test, I need those types of things to help confirm the diagnosis so that I can then start to treat you for that condition.
So let's connect the dots when it comes to COVID. Where does COVID fall and how did you take that into account?
Yeah, so basically, you know, with COVID, it falls into the whole, you know, a critical illness, you know, situation. So when you have COVID, you are also in a adrenaline state, right? And with the hyperadrenaline state, essentially that's going to accelerate your heart rate, and it's also going to, it can cause some slight QT prolongation. It can also bring it out in those patients who have the hereditary form and those things, you know. In Michelle's case, fortunately, she was having issues with palpitations and heart racing sensation, which is something that we commonly see with COVID. And the problem is that it can take a really long time before she gets past that. A lot of it is just, you know, it will get better, but it takes a lot of effort, you know, and I think it takes a lot of effort. And Michelle, is you see, they'll show you some pictures here, but she has done absolutely wonderfully, and she has been able to really change her lifestyle. You know, we reassured her, got rid of the whole concern that she's having, you know, that she has this long QT issue to worry about, and she was able to focus on herself, and she has done the best with this.
I want to pull in some photos because you were suffering from depression, anxiety, but those moments you couldn't move and you said, I got to get back to being a mom and working and being there for my community. Tell us a little bit about this.
That is a picture that I'm sharing for the first time. I was embarrassed, but I'm also proud. After my initial visit with my primary care doctor when they did the EKG, the numbers were like 480 something, and then that's when they sent me to cardiology because they were like, that's high. And then I also went to the weight management clinic here as well, and we decided that we were going to set up a plan. I had started exercising, but I kind of hit that plateau where you just kind of like flatten out. You can't lose the weight anymore. And so after meeting with cardiologists and with the weight management team, we decided, and changing my medicines. I did change my trazodone because I have OCD and ADHD. I struggle to sleep, and that's something that I was on that helped me sleep. That was most likely a cause, on top of gaining the weight, on top of Benadryl for my allergies. So we decided that we were going to make a plan, change my medicines, and then when I went to the weight management clinic, we also set up a plan where it was a full lifestyle change for me.
And you're back to marathons?
Not yet. I was cleared a little bit ago. I am back to running. It's taken a while. So for 2 years and all of the weight that I gained, I was running 5Ks. I know they said 10Ks, but I run 5Ks. I want to get to a 10K. Those are my best friends who have been with me through this entire journey. And we used to run 5Ks every month before COVID hit, and then they shut them all down. But I drink a protein shake in the morning that has high protein, low sugar. And then for lunch, I eat fruits, vegetables, almonds. And then at night, I eat a healthy dinner like salad, or I love red meat, but not in moderation. And I also did start Mounjaro. I have taken that shot, but I also did a lot of research and didn't want to ever come off of it and then gain the weight, because I do know that you can just lose the weight by taking it and you're not as hungry. But if I ever come off of it, which is the goal, I wanted to make that lifestyle change so I wouldn't gain the weight back after being on the shot, and so I've done that, and I am back to running, and I started some weightlifting recently, and so as of today I've lost 65 pounds. And I'm really excited, and I'm like hanging out with my kids again and moving around. I can, it's a good feeling.
It's the things you take advantage. You don't really think about it. You took those things for granted, just hanging out with our kids and having that energy. Be sure to ask your questions for our panel today. Use the chat on YouTube, Facebook. You can tweet us or email us. Info is right there on your screen. Let's get a quick check of our COVID count with Dr. Dana Hawkinson. Good morning.
Hi.
Hey.
Good numbers today. We certainly have seen a decrease. So 26 total, but only 10 active, which is down from the rest of the earlier this week, and 0 in the ICU and 0 on the ventilator. So we are getting better numbers right now.
All right, Doc Hawk, big news from the FDA yesterday. It approved the first ever vaccine for RSV. We knew this would be coming. The shots should be ready for adults 60 and over sometime this fall. The vaccine is for seniors, but we usually think of RSV as a pediatric problem. We know it can affect people in the older age groups, but what should we know about this, and do we think it might be coming for the young ones as well?
Yeah, so again, RSV is a respiratory virus. It does have some seasonality to it, again, like most of the other respiratory viruses, but it does cause significant morbidity and mortality, so illness and death, not only for those young patients, especially those under 6 months, but also those older patients, those older than 60 or 65. So in any 1 year, you can have 60,000 to 120,000 hospitalizations in people over 65. And you can also have up to 6,000 to 10,000 deaths in those over 65 as well. This new vaccine is old technology. It is a protein-based vaccine, but it is safe and effective against preventing hospitalization and death. It's about 84% effective at preventing lower respiratory tract disease, which can lead to hospitalization, and about 90 to 94% at preventing death in those over 60. So this is approved for those over 60. Now we just have to wait to see if the CDC recommends it, which we do anticipate. Those meetings, I believe, will be in later June, and then hopefully it will be available for use in the next coming respiratory viral season. We also do anticipate another adult vaccine for RSV being approved and recommended. And then finally, we are waiting for a children's vaccine, which is actually given to pregnant mothers, and then they are able to confer immunity to baby, but also a new monoclonal antibody treatment for pediatric patients as well. So it's really exciting as far as RSV goes. A lot of prevention and treatment coming down the pike, we hope.
Nothing excites you more than the approval of a new vaccine, right, Doc Hawk?
Yeah, I mean, we're always in a war with our environment around us, and these are things that we can do to help keep us safe and well. All
right, thanks for reporting that good news for us today. Any reporters with us? Let's get to some community questions. And this first one is from Jen, and we know anxiety hit so many in some way or another. Michelle, but were you suffering with anxiety and bouts of depression like so many of us do before COVID, and so it made it harder to decide if that was the anxiety that was the heart, or?
I don't feel like I was depressed before COVID. It was during and then after it. I've always suffered with mental health issues. I'm very open about that. I am a domestic violence survivor, and so I've dealt with that throughout my life. But like anxiety and depression wise, it wasn't like that. I do have OCD and things like that, but I really noticed it after I had COVID. It was just, something was different. You know your own body and you got to listen to it.
Dr. Ramirez, is Michelle considered a long hauler? We hear that term long hauler ever since COVID came into our world. Does she fall into that category?
Yeah, this is this is interesting. We have been seeing, we see a lot of patients that deal with these the shortness of breath and the heart racing sensations for a long period of time. a lot of it is multifactorial, and I do think that, you know, she had a longer course of symptoms. A lot of it was related, it was, you know, several things that were contributing, and part of it was just, I think you had just undergone an enormous adjustment and change in your life that really led to changes in your own body that you had to essentially work on. And by taking care of those you were able to get over it. So I think it's hard to say. I wouldn't say that she's, you know, I think she was able to adjust, you know, after that and make those changes. It's hard to say whether it was all related to COVID, but it was certainly the trigger that caused us and brought the attention to it. And without that, I don't think we would have been able to get her guidance to feel better and to get her where she's at now.
Yen wants to know, does intense emotional distress caused by high levels of stress make it easier to induce arrhythmia?
So any amount of stress, you know, the arrhythmias are all triggered by just the adrenaline response. The higher the stress level is, the more adrenaline you have in your body, and the more you know, palpitations, heart racing sensation you'll experience. So if you have a predisposition or you have some skip beats, those will be more pronounced in times of stress. So absolutely.
Jean wants to know, does long QT basically mean slow heartbeat?
It's a great question, you know. So not necessarily, you know, when we talk about long QT, we're really looking at that segment which we looked at on the EKG. It is very specific to that, you know. With slower heart rates, actually long QT does okay. It's actually when the heart rates are fast, the heart needs to recharge and have enough time to recharge before the cells around that cell that just fires off. Because if one cell is not ready to receive that impulse from its neighbor and it's forced to fire, it causes that dangerous rhythm. So in fact, it's not related to slow heart. It can be more problematic in faster heart rates.
Joellen has a question for Dr. Hawkinson.
Yeah.
She says, the fear that COVID is no longer taken seriously by the public. What are the vaccination rates now? Is anyone even tracking that? Where are we at with that?
You know, they are tracking. I haven't seen anything other than we know that when the bivalent booster was offered last fall, we know that the uptake of that booster was certainly less than optimal, less than expected. It continues to be low. I don't have those vaccination and those uptake numbers off the top of my head, but I do know that there was, again, less than optimal uptake. We know that those people that it continues to be who are at most risk have been good about being up to date with their vaccines, because we know from newly published studies that it does help protect against hospitalization and severe disease still. But overall, I think that the vaccine rates are certainly less than expected and less than optimal.
Yeah, good question based on today's topic, right? All right, I want to get to our takeaways today. And Michelle, just thanks for your candor and being so open with us, you know, the whole time that you've been in our lives. And we just appreciate you sharing everything today. And we're here for you. So what do you want people to take away from your story?
Know your body and trust your body and what it's telling you. I want people to know that COVID was real. It still is real. I personally think that staying up on your vaccines is essential. I'm excited to hear about the RSV vaccine. And trust in your doctors. I really want to thank Dr. Ramirez, honestly, because he took the time to sit down. He drew my heart. He showed me like where an extra pacemaker might be. I didn't even know that we had our own pacemakers. And so really trust those who go to school. This is their life. They dedicate their lives to their patients. And I personally want to thank KU. You guys, when I talk about family, and Dr. Stites talks about faith, hope, and science, that has stuck with me, and KU has been my family. You guys have saved my life, my uncle's life. You took immaculate care of my parents. So I personally think that this is the best hospital. I would trust it over anything, and not just because I work here, because I've personally experienced it. And that just to trust yourself and live every day like it's your last.
Thank you. We follow your lead. Appreciate you, Michelle. Dr. Ramirez.
You know, I think she's the reason we do this, right? I mean, I think this is, when we see results like what we saw with Michelle, where we're able to give her the confidence to continue to work on those things and just give her some guidance, and she does all of that, you know, I think that there's a lot of hope for, all of us, right? Because we're all dealing with some sort of situation. But big takeaway here is essentially, if you have concerns, if you have questions, listen to your body, come and talk to one of us, I think we love seeing you, and we love being able to see what we can do to get you at your best potential. And Michelle, great work. Okay.
Thank you.
Thank you both for being here. Dr. Hawkinson, what's the takeaway?
Yeah, the takeaway is I want to echo what Michelle and Dr. Ramirez said in so many fashions. So first of all, thank you, Michelle. This is why we do it, and it is all people who contribute to the medical teams, from when you first walk into a clinic, from when you first get admitted to the hospital, from top to bottom. It is everybody here with one goal, to help make you better, to get you answers to your questions, most importantly, and then help move on that path with you.
Doc Hawk, thanks so much. Thanks to all of our guests. All Things Heart is coming up at 10 a.m. Here's Alexis Del Cid with a preview. Good morning.
Good morning, Jess. And this morning we have a story with several twists of fate in it. It's about college sweethearts who both happen to be doctors, and one of them suffered quite a health scare.
We were in the kitchen talking, just a regular conversation, laughing, and all of a sudden, I couldn't speak.
That's Dr. Deanna Tadros talking about the strange symptom of losing the ability for her to form words. That was ultimately tied to her heart. And yes, her husband, Dr. Peter Tadros, is a cardiologist here at the health system. And when you hear what was wrong with her and then who had to fix it, you'll be just as floored as we were when we heard the story. It's pretty incredible. Watch All Things Heart this morning at 10 a.m. and bring those questions.
All right, Alexis will be there. Thank you so much to our guests and our viewers. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, Archie Moore's doctor called last Christmas Eve. Her new heart was ready, and they needed her in surgery as soon as possible. I'm Jessica Lovell on the next Morning Medical Update, the extra meaning behind this Mother's Day for a woman with 13 grandkids. That's Friday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.